So at the level of hemisection, the motor loss is a lower motor neuron type of paralysis. So at the level of hemisection, the motor loss is lower motor neuron type of paralysis to damage to the alpha motor neurons or ventral root of the spinal cord. So there will be flaccid paralysis and all the features of the lower motor neuron type of paralysis. On the opposite side, contralateral side, no motor loss. So no motor loss on the contralateral side at the level of the hemisection. No motor loss. No motor loss. Regarding sensory loss, there is complete anesthesia ipsilateral. There is complete anesthesia. Loss of all sensations ipsilaterally at the level of hemisection. So loss of all sensation ipsilaterally at the level of hemisection. Complete anesthesia. Loss of all sensations at the level of hemisection ipsilateral. On the contralateral side, no sensory loss. On the contralateral side, no sensory loss at the level of hemisection. So this was about the feature at the level of hemisection. Above the level of hemisection, the feature is ipsilaterally there is hyperesthesia. So hyperesthesia ipsilaterally above the level of hemisection. Hyperesthesia ipsilaterally above the level of hemisection. It is due to irritation of the cut end of sensory nerve fibers in the hemisection. It is due to irritation or stimulation of cut ends of nerve fibers above the level of hemisection. Now, if the spinal cord hemisection is in the segments T1 to L2, the spinal cord hemisection is in the segments T1 to L2, then there will be loss of vasomotor tone, fall in the blood pressure, peripheral vasodilatation occurs, flushing of skin, and loss of sweating. So if the hemisection is in the segments T1 to L2, so there is loss of vasomotor tone, peripheral vasodilatation, fall in the blood pressure, and there is loss of sweating and flushing of skin. Now we have discussed the features of hemisection. Now on the ipsilateral side, what are the main features regarding motor loss? At the level, features of lower motor neuron medium, and then below the hemisection, ipsilaterally, there is loss of sensations. Which sensations? Carried by the dorsal column tract, say tactile discrimination, vibration, proprioception. Loss of these sensations is not important, ipsilateral. Important is motor loss. Ipsilateral. And what about sensory loss? Ipsilaterally, the general anesthesia at the level of the hemisection. But contralaterally, there is loss of pain, temperature, pressure, crude touch. So these are important for the patient. So in the patients of the Brown-Sequard syndrome, which is spinal cord hemisection, there is predominant motor loss ipsilaterally, and there is predominant sensory loss contralaterally. So in the patient of spinal cord hemisection, there is ipsilateral motor loss, which is predominant, and there is predominant sensory loss contralateral. So on the contralateral side, loss of pain, temperature, crude touch, important. Now on the ipsilaterally, there is motor loss is predominant. And in a patient having motor loss or paralysis, there is no importance of the proprioception, no importance of the tactile discrimination, fine touch, vibration, right? So predominant motor loss ipsilaterally, and there is predominant sensory loss contralaterally. This is the feature of the Brown-Sequard syndrome, or the spinal cord hemisection. So Brown-Sequard syndrome is actually spinal cord hemisection, showing predominant motor loss ipsilaterally and predominant sensory loss contralaterally. So this was about the spinal cord sections. We discussed complete transection, we discussed incomplete transection, and then we discussed about the hemisection of the spinal cord, which is also called Brown-Sequard syndrome.